Hello and welcome. Hello and welcome. Welcome. Thank you for joining us today. You're in the right place. We have a webinar, Equity in Action, for you today, and we have a fabulous panelist group of women that are joining us for these webinars. So we thank you for that, and we'll get started in just a moment. So our panel's here waiting, ready to speak to you, and we just thank you. If you could start popping your names in on the chat, your role, as well as the land acknowledgement. So I'll just leave everyone off screen now, and I'll just be on sharing a little bit about BCHC, BC Healthy Communities, and PlanH. So good morning. Good morning, everyone. Thank you for being here. So let's do some introductions. I am Dr. Connie Alsop, PlanH Delivery Lead. I've been working with BC Healthy Communities since August of 2022, and it's been an amazing opportunity to work with professionals, planners, academics, and community members, mayors and elected officials. So I feel very fortunate to have been here and to be introducing. Thank you for joining us, Leslie and Veronica and Nicole and Christy. I see people's names being popped in from the chat, and I really thank you for that. Getting started here in terms of our agenda today, we have 6 speakers. So it's a full panel to share with you. And what we are representing here is people's various roles, that it takes a whole village to implement equity in action. And so we're actually talking about strategies and ideas of how to implement this today. And we plan in the next hour to share some information about equity in action, to have a Q&A. So please pop your questions in the Q&A. So a little bit of housekeeping is that the questions are in Q&A and we have people collecting, and we'll get to that towards the end. So stick around for the questions. We also have the contact information. And at the beginning, I'll show you some of the resources that we have for you, as well as closing some takeaways and call to actions. So to start today, we have a recorded session, so you'll get an email at the end with that recording, and then you'll have a follow-up survey. So please stick around and share with us your thoughts and reflections on today. BC Healthy Communities, in terms of our land acknowledgement, we are on the Tecumseh and the Lekwungen surrounding territories, where we really feel privileged to live, plan, and work. So thank you for adding your land acknowledgements as well. At BC Healthy Communities, we are a group of planners, academics, specialists, community engagement team. It's a very diverse team that we have here, and we're operating at the intersection of planning and public health. So it's very fortunate to be able to be working province-wide in a not-for-profit organization that is supported by the Ministry of Health, and that we actually really enjoy providing opportunities for funding for communities to launch projects that they really feel a need in their local communities. So it's very community-based. Municipalities, local government, and Indigenous government share with us projects that they feel is really need to take health to the next level and well-being in their community. So it could be a diverse, from housing to food to climate action. So thank you for that. PlanH is a specific kind of program. We have 3 programs going on, and PlanH is the large one that has a number of 33 grants out in 2023. So we're delighted to have that many communities that have applied and are working together with us this year. We have 17 years. So we were just celebrating actually the 18th birthday recently with our executive director, that Jody Muka has been with us and leading the organization for a very long time and bringing this forward for the province of BC. So moving to the next, today's session is about healthy public policy. And this series, we do 3 in the year. We've done one on climate action. We've done one on partnerships. This one specifically is to creating the conditions for thriving, equitable communities. We have healthy public policy is a very powerful tool in helping local governments improve the lives of their constituents. Healthy public policy is established an avenue towards a higher structural organizational change, and that's where we're looking to lead public policy into equity in action this time, and putting on those equity goggles that it'll come up a little bit later, and you'll have an opportunity to hear about how to do that. Today's intentions: increasing your equity knowledge framework, identifying where you are in an equity continuum that I've developed, recognizing the inequities in action and where they exist and the root causes and how to figure out strategies and ways through that, and to apply your knowledge in an equitable decision making and shift the local government level, and to begin to look at equity in decision making and how that shares power, resources, and just engagement with community members. So it's delightful to have our continuum here. This was part of the year's development where we did an LGMA conference as well as an equity cohort this year. And for that, we tried to help leaders see and envision how they can implement equity. And so it was easier to chunk it into 4 categories and looking at just basic first stage of a continuum. And this is where you situate yourself. It's a self-assessment to say, you know, we're just at the awareness stage. Where are we? We're at an awareness stage. What is equity? What is equality? How does this look? The next is understanding. So you're basically taking it into the HR practices. You're also working with professional development, which is what we have a PlanH community sharing today as to where they had workshops and acknowledgement going into their community. The next is analysis, where the leaders and the community managers start to look at, where is this in our policies? Do we have equity in action in our healthy public policies? And the third is pretty much, or the fourth category, is that it's embedded, that everybody feels a personal responsibility to say, is this an equitable engagement? Was that decision, did we include all of the people that would impact? How can we embed this basically from a top down and a bottom up approach to everybody taking responsibility in the organization? So moving through the continuum is something that, as we come to the close of the thing, we'll bring it back and we'll share with you the resources that we can help you on that implementation pathway. But today's session is a live Q&A. Pop your questions in. And without further ado, I'd love to introduce our speakers. So we first have Shelley Sim from District of Clearwater, a counselor. So thank you, Shelley, for joining us today. We have Dr. Santa Chiram, and she's from UBC Okanagan, and we thank her for that joining us today. We have Katrina Thamandam, who is with us from UBC Okanagan, so thank you, Katrina. We have Danielle Noble-Brandt, who is joining us from a manager in Department of Policy and Planning at City of Kelowna. Thank you for that. And Arlene Jakowski, is she there? We're hoping that she's going to jump on. Arlene, thank you, Arlene, for joining us, is a professional planner. And so it's an amazing team of women that have done great work in the City of Kelowna. And so as a PlanH 2021 community, we're really excited to be sharing 2 years later as to the work they've done and the successes that they've had in implementation. So without further ado, I look forward to turning the microphone over to them, and they have Ripples of Change, which is a really exciting presentation to share with you today. Thank you.
Thanks so much, Connie. I just want to also acknowledge Kelly McDonald, who's here as part of our team as well. Kelly, if you want to throw your camera on there for a sec, there we go. Hi, everyone. My name is Sana, and I am one half of the directors for the Equity Science Consulting Group with Katrina Kumanen. We are also professors at UBC. And so we have the pleasure of being able to do this work both in an academic setting and also to have the opportunity to work with different municipalities and groups to figure out how do we take sort of this big concept or idea of equity and put it into practice in a way that is evidence-driven and best practice-driven. And this is one example of the work that we've done with the city of Kelowna, and we're super excited to talk to you about that today. So before I get going, I just want to acknowledge that myself, Katrina, Danielle, and Arlene, I believe we're all joining you from the unceded territory of the Silks Okanagan Nation people. And I will let Kelly, I actually never know where Kelly is. I think she might be in Kamloops, but we'll find out. And I also just want to acknowledge our partners, Interior Health and the city of Kelowna as well. Oh, I don't have control. Slide, please. So before we get going, the work that we are reporting on here has been partially funded by a PlanH grant and has been done in partnership with the City of Kelowna, Interior Health, and is also supported by funding that Katrina and I received through CIHR, IDRC, and the Michael Smith Health Research BC Foundation. Slide, please. So we always start with sort of this big question. I think you're all here, and so maybe you know the answer to this question, but we like to always talk about it, is why should people working in municipalities care about equity? Next slide. And so I usually like to talk about 4 sort of big buckets of why we should care. And the first is, I think the most important, is our humanity. So embracing our personhood. In many institutions and organizations, we know that people are experiencing increased burnout and fatigue about having to sort of deal with the same problems over and over again, where it feels like we're rarely solving problems, and instead we're sort of patching them up. And so being able to embrace our full humanity and our personhood, and recognizing that when we're at work, we actually want to do the right thing rather than sort of the thing that has always been done, is something that's incredibly important to make sure that we keep the best people. We sort of avoid this concentration to sort of mediocrity of people who don't want to change things getting sort of further up in organizations, and the people who are excited to change and to pivot and innovate leaving organizations because they don't have that opportunity. The second is justice. So I have a play on words there of, if you know justice, you know peace, and keeping in mind that we are living in a socio-political climate right now where we're dealing with multiple crises, from global crises like the pandemic to local ones like drug poisoning and anti-racism work and things like that, knowing that when we have a more just society, we have a more peaceful society, and we will have less of those crises popping themselves up, because at the root of many of those crises is actually inequities. And so if we can deal with building a more fair society, we will have fewer of those. The third is excellence. And so I think one of the big opportunities with this increased awareness and attention to systems that do or do not work for us is an opportunity to actually rise to the occasion. And so we have an opportunity to do our work better, because good work is actually equity work. Equity work means that the work that we're doing works for everybody we're supposed to be serving. And that is an exciting opportunity to change the way we understand excellence and understand metrics. And then the last one is the socio-political climate. I think that we all are aware that this is something that has come to the forefront of society, and people are asking and demanding that we do better. And so for anybody in a leadership role and anybody in a public facing role or a public serving role, the bar has been raised. And so whether or not we care about the first 3 things I said, there's an expectation now that we are able to respond to and deal with the issues around equity and inequities with some competence if we're expected to hold these positions. And so we've kind of lost the choice of not dealing with equity at all. And it's something that is expected of us. Slide. So one of the big challenges with doing equity work is we often encounter sort of this idea that if we could just get the right workshop or the right glossary or the right 1-hour session, that we're all going to get this sort of certificate of completion, we'll be equity heroes, and we'll have solved sort of this equity issue. So we can all just move on already. And so this is a bit of a facetious little certificate, but it's often something that's underlying the questions we get about how do we do equity work. And unfortunately, the answer, which is different than some other trainings, is that we're not going to be able to do this. It's not a checklist. It's not sort of a one and done situation. It's actually changing the ways in which we work, our day-to-day practices, our everyday norms, and the ways we functionally operate. And so it's something that we need to continuously build capacity in. But importantly, it's also something that everybody, regardless of where they're at with their capacity, has a role to play. And so making sure that we recognize that everybody's coming to equity work from a different state of readiness, and there's work to be done at every stage of that, and that the work is ongoing. And unfortunately, for some folks, this is not going to be a checklist idea where you just sort of, you take a class, you are now an equity expert, and that's all that needs to be done. This is an ongoing process of how we do the work that we do. Next slide. So when we're thinking about municipal governments in particular, I know that I always say to people that I think municipal people who work in municipal governments, especially planners, are some of the people who understand equity most in a most sophisticated way of anybody else that I know, because the reality is when you're thinking about things like vibrant places, implicitly those places are equitable, inclusive, and happy. And this is a excerpt taken from the Ripples of Change booklet that Katrina and I put together with the City of Kelowna, where we talk about the relationship between place and well-being and equity makes the work of municipalities center the lives of the people they serve. So if you work in or with a municipality, your work matters, because we can't have well-being or vibrant places if they're not fair, if they don't include everybody, and if they don't give everybody the opportunity to enjoy the full potential of their lives. Slide. And so we often talk about that at the root of all equity work is redistributing power, resources, and wealth in society. And so municipal governments are one of the main mechanisms at a local community level that distribution actually happens. And so the distribution of power, resources, and wealth through planning, the houses we build, the roads we build, the transit systems we build, zoning, what we put into our communities, etc. All of those things determine opportunity, dignity, and our collective well-being, all of which is what determines equity. Next slide. And so one of the ways that we come in and try to support people working in municipal government or other organizations is to help them sort of refocus towards a systems lens or a systems direction where we are talking about the distribution of power, resources, and wealth, rather than sort of counting the downstream impacts of inequities. So counting, we often see people want data on how many people of color are living in the neighborhood, or how many people with disabilities, and those are important metrics. But what's more important is understanding if we are fairly distributing opportunities, resources, and wealth. And so in order to do that, we need to be able to build a systems lens. And so a popular sort of parable that we like to start with is about a fish walking up to another fish in the water and saying, "How's the water?" And the other fish says, "What's water?" And the metaphor for that is reminding us that we're all swimming within the systems around us. And for many of us, those systems in and of themselves are actually completely invisible, because unless you're running up against them, unless they're not working for you, it's very hard to see the systems. And so recognizing that we are actually all swimming in systems that are anything but fair. We're swimming in systems that are tenaciously unfair and that are built to benefit and give unearned advantage to some while giving unearned disadvantage to others. And so what we like to do when we come in and work with groups is helping people build what we call their equity attuned goggles, so that they can start to see that water start to shift its direction and start to build water that better supports everybody who's swimming inside of it. Next slide. So part of the work that we did with the City of Kelowna, we used probably to death the metaphor of building our equity goggles. And so we started with sort of the frame and then the lenses, and moving towards how we use those. And so we talk about our equity goggles as things that look for and interrupt the mental models or the taken for granted norms or habits of thought that keep us stuck in inequitable and unjust systems. So committing to do the work, which is a favorite sort of saying of advancing equity, means being willing and able to turn our goggles on ourselves and our own systems. And so figuring out how we ourselves can work differently and how we can create systems that support that work moving forward. And I'm going to pass it on to my colleague, Dr. Katrina Bondin, now to talk about how we did that through the program that we did over a year with the City of Kelowna.
Thanks, Sana. So I'm just going to pick it up from where Sana left with these this approach that we took to supporting a really engaged process of working with folks from the municipal policy and planning team, and then their networks of people within the city to really go through a scaffolded process of building and using these equity goggles. And the work that we designed, the curriculum that we created, was really intended to draw attention to these systems in a really scaffolded way, and to use the process of thinking about and understanding the system in which people were embedded, in which the context of municipal policy and planning was situated, could be understood as something made up of people, and a mix of the alignment and coherence between what's happening at a very strategic and visionary kind of level in policy directions, with what happens to operationalize that through other kinds of less formalized or high level policy, and actually through the day-to-day work and functional interactions within the city. So we went through this series of blocks. Each block had its own set of learning objectives and deliverables, and we provided people with some resources for each block to think about, read through, understand, to give more, like, to sort of step by step build these equity goggles while building capacity and understanding about systems work, about the nature and direction of attention needed to advance equity from within a municipal policy and planning setting, and to start engaging other people in thinking through how this might be operationalized and put into action and embedded within the city context. So we went through by really starting to build a foundation by articulating and understanding our shared commitments, moving through to a really applied equity analysis where we work to identify a very specific policy that we could use as an anchor to understand how the system was working. We then used that process and what we learned from the process to draft the framework, engage and really extend the dialogue with others in the city, and with some partners outside of the city. And then we talked about how we might put that into action. We went through many iterations of a framework before we arrived at a final one, and spent time to talk with folks about how it might fit and work with the context that they were engaged in. Next slide. So here's an example of how we scaffolded the process and workflow in these block style modules. So we had a bit of a binder that we created for folks. It was a digital binder, although I think some people might have printed it off, where we gave specific objectives, outcomes, and deliverables. We offered some prep work. Usually this was a mix of some reading, some reflection, some very structured and purposefully designed questions. Then we offered, sometimes we used some videos or gave specific assignments or pieces of reflective work for people to work on. We held these large group workshops. We gave people individual work to do. And then Kelly is going to talk a bit more about the small group design labs that carried through and, pardon me, made the sort of created the functional space to advance the work that needed to happen through this process. Next slide. So here are some examples of things that we talked about, really powerful, pardon me, ways that we drew attention to the ways in which health equity work can be advanced or held back in any setting, really, but we always made a very purposeful effort to apply it in the municipal setting. So here's one example, and this is, Sana and I will talk about this with any group that we're working with. Pardon me, my throat is a bit dry, apologies. There are two sort of broad practices in talking about and framing inequities that, thank you, that we go through. Sana's office is next door. Where health inequities tend to be framed as either problems with solutions or something that is inevitable and doesn't require explanation. So one practice that entrenches inequities is framing them as inevitable by not referring to their causes, by suggesting they're mysterious, by focusing on the downstream symptoms, pardon me, of inequities, or by situating blame for them within individuals rather than within the systems. So a really good example of this is drawing attention to culture or ethnicity as the cause or the reason for an inequity rather than the racism or exclusions that come or social exclusion that is actually at the root cause. And an alternative practice is to talk about them as problems with solution, where we explicitly understand and name the causes, talk about them as actionable, situate them in relationship to unearned advantage or unfair, unearned privilege, and really drawing attention to the systems of power that lead to unfair distribution of resources and power in society. Next slide. This is another set of tools that we use throughout the process to guide our work and thinking. This is a set of principles for making equity-centered choices. These were derived, I was the lead researcher on this dialogue-based research that led to these principles. They were developed in a context outside of municipal policy and planning, but they really resonate broadly. And we can make this, there's open access resources about these principles, but these 6 principles really ended up being central to the model and framework that was evolved through this process. Next slide. We also really made an effort to differentiate between 2 really broad narratives that tend to really uphold or put a lot of emphasis on equality and on narratives in society that are really pervasive. Like if people just work hard and pull themselves up by their bootstraps, everybody has equal opportunities for everything in this world. And in North America, in Canada, the United States, there's this sort of American dream ideology where everyone could possibly have the same kinds of outcomes if they just worked hard enough. So we really tried to challenge that narrative and differentiate between equality and equity and add a conversation about justice and fairness to the modules as we went along. Next slide. So here is, we're just going to give you a snapshot of the booklet. This is the cover page, ripple effects. We talked about ripples of change or ripple effects and the impacts that we can make, because we really wanted to use, this metaphor came out of our workshops with the folks at the City of Kelowna through their creativity and their ideas. And it was really talking about how important it was to think about systems and also to recognize our role, our individual role within those systems, and to embrace our own sphere of influence and agency over those systems. Next slide. The booklet offers a bit of foundational content on definitions. It talks about reasons why. It talks about what equity work might look like. It offers the framework, and it talks about some ideas on monitoring and evaluation. Next slide. So here are just some of the major messages that we left with and that the booklet and the framework emphasizes, is that inequity is real. It warrants our attention, and there's lots that we can do. They're avoidable, they're human caused, and therefore humans can do something about them. That health isn't devoid of politics, it is political, and ideology, values, and how we see the world and our role within it really makes a big difference in how we understand the problems that our communities are facing. And when we can recognize our own agency in doing something within those communities and within our own spheres of influence, we can actually embrace being part of the systems change that needs to happen in order to advance equity. And then the 2 other ones I wanted to just emphasize here is just that our choices of language matter, and recognizing our own positions of privilege and power matter in doing this work, because all of it is situated in context and history. All of it involves making decisions and choices about how we connect what we know, what we intend, and what we do. And the more attuned we are to equity, the more we have equity goggles on in that process of decision making, the more likely it is that our work, our efforts, our day-to-day practices are going to advance equity. Next slide, and I think I'm turning it over to Kelly.
I'm here. Thanks so much, Katrina. I want to recognize and normalize for the group that striving to work in equitable ways and take on projects that use an equity lens can be really challenging work. And so one of the strategies that can help to share that heavy lifting is to partner with other people and with other organizations. So I was fortunate enough to be asked by the staff at the City of Kelowna, Danielle and Arlene, to work alongside them and Sana and Katrina as academics and experts working in the field of health equity on the project we're talking about today. Interior Health has a whole team whose role it is to advance community wellness through the development of equitable built and social environments. We're part of the Healthy Community Development team within Interior Health. And we work with community leaders and decision makers like local governments to support policies and plans that consider the needs of all people, because we want to see equitable health outcomes regardless of what group or groups people belong to. My team can work with staff and or elected officials to help navigate equity work in a community setting. We often share data and evidence to help set the stage, looking at overall patterns within a community and local data to provide context and to demonstrate that there are disparities. We can help local governments think through community impacting decisions to see who might benefit, who will or may be excluded, what contributes to that exclusion, and what can be done differently to ensure inclusion, and how might that inclusion have a positive impact. So in short, we can help to add an equity lens to community work. We can also support understanding through delivering workshops, having informal conversations, attending meetings, and reviewing and offering feedback on existing or new policies and plans. At times, we operate in this consultative manner, like I've just described, and sometimes we're more directly involved in the process. This can include facilitating sessions for those who are planning for, advising on, or making decisions about current projects, to build capacity and share knowledge around equity and achieving equitable results. So for example, with the City of Kelowna Equities Project, my role was to facilitate the design labs, as Katrina alluded to, with an internal city advisory committee to help them to support the progression of the work of creating a policy and planning equity framework. That included helping people to see their own roles in equity work, analyzing a city policy, and identifying important partners for testing and validating that work along the way. In other communities, it can be as simple as alerting communities to grant opportunities to support equity work, like the grants available through BC Healthy Communities, through sharing best practices from other communities, and offering tools and resources. What we bring to the table as a team will depend on the needs of the community. And we want to partner in meaningful ways to see those health outcomes. So I'm really grateful to the City of Kelowna for asking me to be involved and to work alongside people in this realm, because it does matter. It is hard, and it takes a lot of people to move the bar forward. Thanks.
Thanks, Kelly. Picking up where Sana and Katrina have left off, City of Kelowna planning staff really wanted to put this impactful work into use in our organization. And based on some of the questions that we heard from our colleagues, we opted to prepare a practical use guide for using the framework that was very explanatory, visual, and tailored to the city's work, particularly as it relates to planning. So based on the work that Sana and Katrina had packaged into their booklet, staff prepared this visual wheelhouse, which walks users through an approach to incorporating equity into their daily work. It asks each of us to think about our role, think about commitments to equity, asking equity questions, and to make equity choices. Currently, this operational tool is being used as a resource by policy planning and community planning staff, with some interests from other groups across the city. It has been most impactful through upstream planning work and designing long-term master plans, engagement approaches, and policy formulation that is really being designed through a deliberate equity framework lens. It's also going to be serving as a launch pad for an imminent equity strategy that is in the city's work plan in the upcoming years. So with that, I'd like to pass it over to Katrina, I believe, to close us out with a quote.
Thanks, Danielle. Sana and I are both looking at each other because we were both unsure of who was closing us out. That's okay. But Danielle, thanks for sharing that. We were so happy with the end result, and the booklet, the efforts that that unfolded over the time that we had together, I think really offers a lot of really highlights amazing work that's happening in different municipalities across the country, and some international ones as well. And so it's really was designed and tailored to give people very tangible, practical ways of thinking about how to do this.
And we'd like to thank you for that. And thank you so much for both of you and for your team. We're very delighted to have the whole team. And, you know, it's amazing when you get a group of people working together, how much you can advance a concept. We are delighted to showcase the knowledge mobilization or knowledge translation that this community of PlanH, working together with the Academy and the local health authority, were able to take theoretical knowledge and put them into practice at the local community level. This was just a snippet, and we're delighted to showcase our community's work 2 years after that they've done some really amazing long-standing work in advancing equity. We are also grateful to have an elected municipal councillor here. Shelley is here with us today to share with us a little bit background about the equity curriculum that BCHC has worked to pilot with leaders and local government mayors, councillors, CAOs, as well as some strategies on how leaders can champion inclusive policymaking. So I turn the microphone over to you, Shelley. Thanks for being here.
Thanks very much. My name is Shelley Sim. As was said, I'm a councillor for the District of Clearwater. And this morning I am joining from Clearwater, which is within the ancestral and traditional and unceded territory, the Secwepemc Nation. I don't know about all of you, but I continue to learn, and this presentation this morning was incredible. I'm here to just talk about what it is to be a councillor from a small community, and we are just starting our journey. And what I learned through taking the equity class was that there needs to be a paradigm shift in my community. And we need to move our position, which is held by government, which is the role of expert, into being one of being a learner and a listener. How do we hear the people that we serve? Because I think that that's what most people in elected positions want to do. We are here to serve, and we are here to try and move the work so that we can have those vibrant communities that, you know, reflect everything that was said in this presentation. So one of the reasons I took the course is because when I sit with my council and I sit with staff, is that I recognize that we don't have shared language. We're starting from a place with assumptions of what we think one another might know and not even recognizing what we don't know. So having that language to be able to come together that will impact policies and the change of framework within our community was really important. And it's scary. We are 2,200 people. We don't have a large staff, and it was really easy to fall back on some of the excuses of, well, our finances are limited and we're short-staffed. And then probably the big one, which is the fear of failure and not getting it right and staying quiet. But that's no longer an option. And I'm so grateful to be in a forward-thinking community that's ready to take this forward. So some of the things that we had to ask is, when we go out and we are doing some of our consultation, is this framework is restrictive. And to use the phrase about swimming in the water, I was swimming in the water and I just didn't even recognize the systems. And so that was probably the first step. So as we went on our journey, we needed to look at, what does this equitable community process look like? So we had to look at acknowledging our community needs and the historical context. We had to ask ourselves, what would meaningful engagement look like? Who is at the table? Who is not at the table? And if they're not at the table, why aren't they at the table? What are the barriers that are preventing them from being a part of this conversation? And we had to look at the community engagement framework to address our policy gaps. We needed to understand that everyone in our community is not in the same place, and that some people will require more support and resources. And I think that was shared in the presentation, it is that sharing of power, sharing of resources. Who is being impacted by some of the decisions that we're making? And were they at the table? Were they a part of the process when we were making these decisions? Were we making them with them or for them? There's also the issue of social tension. And through this process and through this learning, I recognize that the social tension is created when people are left out, not invited, not included, and not considered. And that's a really heartbreaking reality to come to terms with, is that having been blind to some of these really important needs. And so the equitable engagement considers the unique needs of each population group. And in a conversation with Kelly, and I'm so grateful for her support and what she was able to share with me, is that diversity is fact, inclusion is the work, and equity is the result of that work. And so as I move forward, I just am so happy to be with my team who wants to learn together, so that we do have shared language and we do have a shared path that is going to hopefully make us better servants in the world of local government. Thank you very much.
Thank you, Shelley. That was amazing to bring forward peer-to-peer learning. One of the things that we found from the equity cohort is that we started to ask questions of each other and situate ourselves in terms of some of the work that is being done or has been done at the local level. And so Shelley was able to bring forward her perspective and the good work that she's doing in her community as well. We heard from several other leaders during the cohort, which was a series of meetings throughout the year, check-in, some curriculum to read on. So it was a continuous learning and peer-to-peer development. And so that's one of the things that we were piloting, is how best to support leaders like Shelley and others. So we're delighted to have that, Shelley. Thank you so much for raising that. One of the things we were doing is also designing some other supports and tools and resources to help people to continue in addition to the cohort for the equity continuum. At this point, we have a whole panel of people. Please be sure to keep popping your questions in. We have some questions coming in that we look forward to sharing with the team, and that the panel would all pop themselves back on so that we can begin to answer some of the audience questions. And thank you again as the team comes on. My mistake in missing Kelly, a valuable speed dial member that I had organizing this panel. So thank you to everybody. And coming on, yes, thank you all. Thank you, Katrina and Sanya, we have you popping on as well. That's fabulous. Thank you. Thank you. So this is a fabulous panel to really look at top down and bottom up work that it requires the whole team here. And that's what we're trying to really portray to you today, is that it takes a village to implement the equity in action work. So without further ado, I have some questions that have come in, but I would love to turn it over to Arlene and Danielle just to talk about 2 years looking back. How is it going in the city of Kelowna? Any final words or comments that you'd like to add to that?
Thanks, Connie. Yeah, I will maybe just take one kind of practical example. The city of Kelowna right now is in kind of the later phases of working on updating our community climate action plan, which we are now terming a climate resiliency strategy. And through this approach, we've been able to take the internal equity framework that we shared and apply it as an overlay so that we are considering climate action through an equity lens. So really understanding the role of how much climate can impact and influence equity across community, both in tangible and physical ways, and obviously in social and emotional ways. So that is one practical application of how the framework is influencing policy formulation. I'd like to just maybe pass the baton to Arlene, and she can share how it's showing up in some of our housing policy work.
Thanks, Danielle. Yeah, as many folks, I'm sure around the province and across the country are working on right now, there's a lot going on in the housing space, which I do some work in. But I can just highlight one quick example. We did a housing needs assessment this past year, so a bunch of reporting on housing, and as part of that, some engagement. And I felt that this equity framework and kind of new ways of thinking about equity was really helpful in framing the engagement in particular, and thinking about how we can kind of leverage the most resources to engage with folks who are from equity seeking groups or maybe more difficult to engage with, and kind of taper off as much resourcing for folks who are easier to engage with. So we kind of flipped it on its head for how we do engagement usually, and really focused quite heavily more in-depth and intensive engagement on folks that were harder to reach. And then for people who, you know, have easy access to a computer and an online survey or email might be more applicable for them, we did a bit of a lighter touch. So that was a recent example in the housing world. Thanks.
That's fantastic. Thank you. You know, the knowledge mobilization and putting it into practice is one of the questions that sort of leads into, we have an anonymous person asking about specific examples of policies, services, and projects that were reviewed as a result of this framework in the city of Kelowna, and were there changes that were based on the review? So I think you've kind of addressed those impromptu questions that have come in. So thank you to you both. We do have one in terms of the excluding the health authority's data. PlanH uses when people apply. Equity lens is one of the ones that we're looking at in the grant applications. And so as this community brought forward this project, it was a prime one to be funded by PlanH. And we're certainly looking at ones that are, as Arlene described, narrowing down into housing, equity and housing frameworks, or food policies, food security as well. Question over to Shelley. What kinds of things specifically would you recommend to future councillors, like local government leaders? What would you share with people around the table about equity, and what can you do in the next 5 to 10 years if you're planning forward, or in the next year?
Wow, that's certainly not the softball question, is it? You know, we are at such a beginning stage of the journey. Today was a really important example about why the work needs to be done. And at 11 o'clock today, communities across the province will be lowering the flags to recognize Indigenous veterans. And within our community, the question came up, well, why is that important? And I think that alone just indicates that we will see our success when maybe we don't have to hear those questions of why, is that it will already be a part of our journey and of our community fabric. So what I say to future leadership is all you can come in with is just humble servitude, and just that willingness to listen, to grow your community so that everybody sees themselves reflected in it.
Thank you.
I don't know if that answers the question, or if there could be more elaboration, but I will also just maybe complement that with, in order to hear that listening is we have to reframe our spaces in how we listen. And so one of the things that we're doing is, rather than having that stiff podium, you know, where people have to come, and, you know, the example was we're inviting people to come to our house municipal office to tell us about their lives. Where are we in going to them? How are the tables round? How are we framing it so that we are putting ourselves in a position of being an active listener and that keen learner? And it does come from that spirit of humility.
Thank you, Shelley. Yes, we had some of those conversations during our cohort group and check-in online, where it was just an amazing opportunity to just put on those equity goggles and to see where our engagements or our actions or even our mindset. What is our privilege, and just recognizing that a bit for ourselves and knowing how we can begin to start and have the conversations. So it's kind of like a mind shift that stays with you, and then you continue to see more and more of how you can do the good work in your field. Other questions that came in, Sana, are you able to share the Ripple Effects book, or is it posted on your website? Is it listed anywhere that our audience would be able to have access to it? Or
Yes, Connie, I responded in the chat and just shared my email for folks who are interested in learning more about the booklet, because we need to think about how we can share that publicly.
Okay, great. I just wasn't sure if it was on your website or accessible. Okay, thank you so much for that. I don't know if there's any other questions that the panel wants to ask each other. We're kind of coming to a moment where we can add panel questions to each other. Happy to do that as well. I have some more questions I can seed in from the audience. Shelley, we have one for you specifically. May we attribute the quote, "Diversity is fact," to you?
And I responded back that that is a result of the fabulous Kelly McDonald. And I just found that that was just such a grounding comment that helped me understand the work, because it does seem very overwhelming. And even in this presentation, I mean, there was so much in it that I feel like, am I ever going to get there? But Kelly's comment just helped me understand that it's one step at a time, and doing so with people.
Thank you. Yes, and that was one of the other questions that's come in as well, and I'm not sure who to direct this to directly. How does the framework address City Council's roles in adopting equitable practices? And I don't know if we've gotten into some of that discussion in the panel. Is that somebody, Danielle? I don't know if that's a you question, to throw it out to you.
Yeah, maybe Sana Katrina can also weigh in, but at this point, we are using the framework more internally. So at this point, it is guiding work that is very upstream, community facing, but also helping staff be situated in a place that is more equitable as we intersect many challenging topics like housing, climate crisis, public health, and city building at a time where there's so many intersecting topics that need equitable solutions all at one time. Katrina or Sana, I'm not sure if you have any other thoughts.
Yeah, maybe I'll just build on that, because I think, Danielle, I mean, these are really complex settings, and municipalities are under a lot of pressure, just like any public institution is these days. But municipalities, like a lot falls on the shoulders of municipalities, and there's complex histories and different reasons why the work might be more or less challenging in different settings. But two things I would say: one is that I think that the approach and the booklet really tries to draw attention to the possibility of this being something, like, it was designed in the context of municipal policy and planning and specific to that group, but it might resonate beyond that. And that's really up to whoever receives it and how they see themselves reflected in it. And we've tried to design it in a way that makes that a really warm invitation to look at our own roles and to really start with ourselves, no matter what that role might be. And so this is why it actually resonates well beyond even municipal settings, that it really has lessons and insights that could be for anybody, anywhere. And the other thing I think I would offer for city councilors specifically is that one of the ways that I think this kind of work can get some traction beyond there is public pressure, and there's an increasing rhetoric and demand for public institutions to be talking about their equity, diversity, and inclusion commitments. But I think when we offer people really tangible and meaningful ways to advance that work within their own setting, in ways that help them achieve things that that are like serve more than one purpose, that are really synergistic with other goals, it can actually be a resource to help grapple with that intersecting complexity, and that underpinning all of these many demands are issues of equity. And so paying attention to equity work actually helps us to do the work that needs to happen in even better and sometimes more fulfilling ways. So we can try and make that a convincing argument. And I think that the best way to do so is by actioning it through. So when people see that there's like a very nice win-win, it's easier to keep doing more of it. So they need good celebratory examples of why this helps make work that they want to accomplish feel better, work better, and advance more vibrant, thriving communities in good ways.
Thank you for that, Katrina. One of the things that we talked about in the cohort was very much of that, is to be able to have support for councillors and mayors, and to be able to have peer-to-peer learning, and just to share it widely. And just the strategies that Shelley was able to share with us today is some of those is to how to make those tough decisions. I know that councils are faced with multiple layers of conversations, whether it's housing, whether it's food security, whether it's like Shelley gave us an example today. One of the questions that came in was, how would this apply in an Indigenous local government context? And so maybe that's work for the future and next steps that we haven't answered necessarily here today. But I think I'll wrap up our webinar at this point with a few points from BCHC, and then we'll put out all of the email addresses for everyone so that you can contact the UBC Okanagan or Kelly for their health authority information that she's so kindly shared with everyone. So just in terms of closing at this point, we have an equity continuum here that's an implementation pathway. And as I designed and created this, I was able to put the resources that BCHC has and just a sampling of some of them. And we really encourage you to reach out. We have an equity curriculum module 1, which helps you with the awareness as to what is it, infographics, resource page that you'll get. We have a follow-up email with a link to this video for those that have joined us, and for those that you can share widely from our YouTube channel. We are also sending out the resource page, which is a variety of resources you can learn and add to your reading list. The understanding, we have an equity module number 2, which really goes into equitable engagements, and we fund that with grant opportunities, whether a $5,000 or a $15,000 grant, and then support you throughout a year through an application. Employment partnerships, resources, tools, PlanH connected grants. Analysis, we really look forward to the cohort continuing, and maybe year 1 and year 2 cohort groups begin to merge, and we share widely as to how it's impacting people at the local level and continue the conversation. BCHC is at a strategic position to be able to convene calls with communities across the province. And supporting equity and action guide. We have action guides. Some of them have been listed in the chat by one of our people from the team here today. There's also a workshop that we're happy to come out and do at a local level or online. And the final is equity being embedded into your community, which is monthly groups talking about it, diversity, equity, and inclusion, looking at an analysis of planning for equity policy guide frame, and utilizing multiple tools. So reach out to us and we'd be happy to support you. Moving forward, we also have for you a cohort entry. So a call to action, there's a resource sheet. You can look at that and start reading for yourself. We also have the self-guided online curriculum. We have webinars that we've done that we're happy to support you, and we have the grants available to you each year coming out. The takeaways that we hope you found today were useful to you is the equity curriculum cohort sign up. You can email me directly, Connie at BC Healthy Communities, to sign up for our 2024 Leaders Cohort Group. We had also designed some cards for leaders to take away. It's kind of an Esther Perel's strategy idea, where these are just conversation cards that you can take to a coffee table, to a coffee chat, or to the boardroom table, and just asking each other, how would we do this, or what would we do this? So to keep the conversation going, basically. So we have those available, and we look forward to your filling out the survey, because that was really an important piece, that we get your feedback onto how this was for you and what kinds of things that you took away from our webinar today. And we're delighted to say that we are so grateful to all of the team that came, and we have little thank you cards from BCHC that we'll be sending out to acknowledge the work and to express our gratitude for the good work that's being done in our communities, and for sharing across the province with others in our community that can continue to do this work as well. And so finally, thank you from everyone. Our contact information is here. That will also come out for you in the follow-up webinar. And please stay tuned for future webinars that we have going on from BC Healthy Communities in 2024. Thank you for joining us today. And it's been my pleasure to have you here and to host you and to host all of the speakers. So thank you again. And we hope you can put this into practice: equity in action, what leaders can do to champion inclusive policy making. Thank you. Good day.